Today on MedTech TV, we are discussing the wide world of surgical robotics.
I'm Paula Rutledge.
I'm Chris McClough.
And I'm Reece White.
And welcome to MedTech TV. So robotics is one of our very favorite things to talk about here at MedTech TV. You think about, I remember as a little kid, it was the Jetsons. And just all the little toys. You thought, oh, that'll never happen. And here, robotics are just so commonplace. I mean, you got 8-year-olds with drones. You've got folks doing surgery using robotics. It has really come a long way. And Reece, you have been researching a new company that I'd like to know more about. So
last week we touched on a little bit of the robotics that are happening in manufacturing and mentioned a little bit of that, but I did want to touch on a couple of companies. Really what we've looked at, the majority of people when they think of medical device, when they think of surgical robotics, think of Intuitive Surgical and Da Vinci, and it's becoming a crowded market. We're starting to see a lot more opportunity for diversity. And one of the companies that very recently has come out of their stealth operation mode has been Cambridge Medical Robotics. Cambridge, they're a little over 3 years old now. They've just released the first pictures, which we'll see if we can put up on the screen here. The system is made to be a lightweight, fast, easy to use surgical robotic system that mimics the surgeon's arm. You'll see it has a couple different points of articulation. And then that wrist is supposed to have 4 axes of movement. Really, it's supposed to hold the instrumentation the exact same way a surgeon would. The idea here is that a lot of surgeons, when they're learning to perform these minimally invasive robotic surgical procedures, they have to almost relearn the surgery. It can be kind of a long and difficult process, and the results are kind of tepid until they've performed 150, 200 of these procedures. But with this system, they're looking to make it a very ergonomic and more of a plug-and-play option so the surgeons can perform it the same way they have been.
Yeah, they've been so stealthy that we haven't really found a lot about it. I know they've made some announcements recently. They're starting to grow. They're not FDA approved yet, so obviously they've been a little bit careful with releasing information. But I understand they just hired their 100th employee well ahead of the schedule they were having. So it's definitely one to watch. So I know you do a lot in robotics as well, Chris. So how do you think companies like Cambridge or CMR is comparing to some of the other robotic companies that are in development now?
Right. Well, again, going to Reece, the household name was Da Vinci, right? It was Intuitive for a very long time. But to assume that there hasn't been skunk works projects in some of the larger, the Fortune 5s that have the deep pockets that weren't necessarily the scrappy startup that developed into a multi-billion-dollar company is crazy. So I think we're getting the press on kind of these, kind of the smaller entrepreneurial plays that want to develop out, but I am more than certain there's probably some things in the works, and not to mention Google's Verily jumping into the market, as well as with the partner with Johnson & Johnson. My assumption, just understanding how much they play in the general surgery space, that would be an interesting bet to assume it might be OBGYN or general surgery, the very similar market that Intuitive. And it's so funny is the costing perspective has always been the kind of a hot topic, right? From a robotic standpoint, for how pressured the hospital system is on preserving the cash, and you go through a capital purchase as a substantial portion of the budget. That's always been the biggest thing. So if someone comes out with a efficacious and safe robotic system that could be, from a pricing perspective, very competitive, I think it'll have some legs.
I think that's the race right now, to be honest with you, because the Da Vinci system historically is a massive capital expenditure for a hospital. You're thinking almost $2 million to put a system in place. And it can be difficult to see the return on investment for so many companies. So what we have to look at is there are all these different companies, all these different surgical robotics companies that are coming to the forefront now. You look at was it Transenterix just opened Centers of Excellence. I think it was here in Florida,
Right,
actually, if I'm not mistaken.
Both Transenterix and Titan
That's right.
have systems in our where we are is Orlando, Florida, just a stone's throw from each other. From
each
here,
of them are looking to bring something different to the table, and Cambridge is about to throw their hat into that same ring. But I think what you see is after the Mako acquisition of probably one of the largest, most headlining acquisitions to ever happen in medical device, I think that you're really going to think everyone sees the money in it right now, and everyone sees the clinical efficacy. You make it faster, you extend your surgeon's life, they can operate longer.
It's a broad price point. It's a broad, and I think it ranges anywhere from I'm assuming a couple million down to I think of a lower cost or secondary system being but the price point ranges, I think, is what you were saying, and what's interesting is if we can get that price point lower, there'd be the run.
Well, that's the key. I mean, the first company, if it's Cambridge, that comes out with a very efficient, with a cost-effective option for surgical robotics, it's going to be tough for other folks to touch that. But it's really a race to the bottom right now.
But you've got to think intuitive, because this started 17, 18 years ago, and really I think set the bar incredibly high. And I think that even some of the regulatory processes that really thwarted Transenterix last year when we thought they were going to get their approval, I think that now that the FDA is more comfortable with the regulatory processes in robotics, hopefully there'll be other companies to come to bear that can really help on both the clinical side, but also with the sheer cost of a robotic system. So I know Transenterix is on the move. Do you know what applications that Cambridge is looking to come out with first?
It's a lot of the buzzwords that you've heard from surgical robotics in the past. They're looking at urological, gynecological procedures as well. They're looking at general surgery. It's the same places that you're used to. I think some colorectal as well, which
MedRobotics just had their first in man a couple of weeks ago for colorectal procedures.
Right, they just received expanded FDA approval in January or February, I believe, for that, and they're the Flex surgical system.
Yes, yeah.
And so I look at companies like MedRobotics, and going back, I remember the early days of Mako Surgical when I was working with Mako Surgical in a consultative capacity. It was so much fun because it was a bunch of guys. They had a real Area 54, which was kind of scary, and just kind of the velocity that these startup companies come to bear with. And I'm hoping that companies like Cambridge, I'd look at MedRobotics, was up there not too long ago, and it's amazing what they're doing, and they're increasing the applications that they have. So I'm looking for some really great things to come out of MedRobotics, and then certainly Titan has some applications as well.
Titan, Transenterix. I mean, those are I think the smaller cat names that we've looked at. Both are obviously publicly traded, I think over the counter. But I think that's what we're waiting. And Transenterix is I think recently answered some questions in response to the FDA. So don't necessarily read in between the lines. It could be good, could be not as good. You don't really know. But what would be exciting if it sounds like they're probably closer to approval if that ends up happening than anyone else in the market. It would finally be competition.
Yeah, and they've brought some really great people on board in all these companies lately, and I think it goes back to, for medical device companies, it's hiring the type of people that can really move the needle. And some of the recent hires, certainly they've got some strong people and have had at the top anyway, but some of the people that they're bringing in, particularly on the commercialization side, I think the R&D piece has always just been a high standard for most of these high-tech companies, but bringing in these really strong commercial leaders, I think, are really starting to move things along. And also on the regulatory side, you think about, again, Transenterix last year. It was just, I think it was just a heartbreaker when they had what they felt was a really terrific product, and they didn't quite make that last turn when it came to the FDA. And I know that Cambridge is going to have certainly some similar challenges, as all companies do, in getting things past the FDA. And I understand that certainly as difficult as it is here in North America, the European Union, through the CE mark, has been very clear that they're going to be tightening up and making the regulatory process as stringent there as it is anywhere. So I think that in terms of companies having strong regulatory talent is going to be as important as the commercial side.
Yeah, the EU just, I'm sure that I think a month or two ago, just released their new MDR regulations, which are going to be going into effect, I believe, in May of 2019 or 2020. But when that happens, the regulatory process for CE marking your medical devices will be significantly more difficult.
And more expensive.
More expensive as well. That's a very good point. So it's going to make the barrier to entry that much more difficult. So it's going to be interesting to watch these companies that have been able to develop these prior to those regulations changing, to see how well they're able to adapt as that regulation comes down the pipeline and we understand more about it.
Exactly. And you had another company that you were starting to chat with us about in a conversation last week, one that I'm not as familiar with, CSA Medical.
Yeah, a little outside of the surgical robotics realm, but something that's definitely at the forefront of various types of treatment. We try to keep our eyes out for new types of technology or folks who are doing innovative things around the country within the medical device space. And this one is CSA Medical. They work specifically in cryoablation for Barrett's esophagus, for esophageal cancers, any type of malignant or benign tumors that are there. Essentially, the system uses liquid nitrogen to freeze the tissues and kill whatever might be in there. It's kind of impressive, but they just had an FDA release of a new type of catheter, which essentially cut down on their procedure time by, I think it was 50%.
Wow.
But it was a massive change for them, and it was something where it really came down to the actual manufacturing of the catheter, the way that they changed it, the materials involved. But they're another one to watch that I've really been interested in the technology. And Barrett's esophagus, this type of GI, upper GI cancer is something that is not as well, not as widely, it's something that's not as widely known or talked about as some of the other cancers that might be more prevalent. So it's
probably because of the number of patients, that suffer from these ailments.
Yeah, but it's a cancer that's absolutely deadly if it's not caught in time. So it's something where this type of treatment is absolutely necessary to have on the books.
And CSA has got a potential solution for this. So terrific. There's just so much incredible medicine taking place right now, and new technology to take to bear. And speaking of that, next week we're going to turn the page and talk a little bit more about the neurosurgical market. We'll be having Greg Drolshagen joining us next week and talking about some of the incredible improvements in visualization, navigation, and imaging as it relates to neurosurgical procedures. So I hope you'll join us. Don't forget, if there's a question that you have, go ahead and respond to the link at the bottom of your screen. If you're a company who would like to be featured or highlighted on MedTech TV, we'd love to hear from you as well. Enjoy the rest of your day, and thanks for watching.